Infertility, male and female. Infertility is defined as the inability to conceive after 12 months of regular, unprotected sex, or 6 months if the woman is over 35. It affects roughly 1 in 6 couples worldwide, and the cause is split fairly evenly. About a third of cases are attributed to female factors, a third to male factors, and the rest to a combination of both or unknown causes. Female infertility ovulation disorders are the most common cause, accounting for around 25 to 30% of female infertility cases. When the ovaries don't release eggs regularly or at all, conception becomes difficult or impossible. Polycystic ovary syndrome, PCOS, is the leading culprit here. It disrupts hormone balance and interferes with normal ovulation cycles. Fallopian tube damage or blockage is another major factor. The tubes can become scarred or blocked due to pelvic inflammatory disease, PID, past infections, especially chlamydia or gonorrhea, endometriosis, or prior abdominal surgeries. If the egg and sperm can't meet in the fallopian tube, fertilization can't happen. Endometriosis deserves its own mention. It occurs when tissue similar to the uterine lining grows outside the uterus, on the ovaries, tubes, or other pelvic structures. It causes inflammation, scarring, and can interfere with both ovulation and implantation. Uterine or cervical abnormalities such as fibroids, polyps, a septum, or an unusually shaped uterus can prevent an embryo from implanting properly or increase the risk of miscarriage. Cervical mucus problems can also block sperm from traveling toward the egg. Primary ovarian insufficiency, POI, sometimes called premature menopause, occurs when the ovaries stop functioning normally before age 40. Egg supply is diminished or absent, and hormone levels resemble those seen in menopause. Age is a powerful biological factor. Female fertility peaks in the early to mid-20s and begins declining noticeably after 35. Both egg quantity and quality decrease with age, making conception harder and miscarriage more likely. Other contributing factors include thyroid disorders, elevated prolactin levels, being significantly underweight or overweight, excessive exercise, chronic stress, autoimmune conditions, and certain medications or cancer treatments like chemotherapy and radiation. Male infertility. Male infertility is just as common as female infertility, but is often less discussed. The vast majority of male infertility problems relate to sperm, their production, quality, or delivery. Low sperm count, oligospermia, means there are fewer sperm than normal in the ejaculate, reducing the odds that one will successfully reach and fertilize an egg. In some cases, there are no sperm at all, azoospermia, which can result from either a production problem in the testes or a blockage preventing sperm from being released. Poor sperm motility refers to sperm that don't swim well. Even if sperm count is normal, sperm need to move efficiently and in the right direction to reach the egg. Sluggish or erratically moving sperm significantly lower the chances of fertilization. Abnormal sperm morphology means the sperm are misshapen, wrong-sized heads, bent tails, or other structural defects. While many normally shaped sperm are present in any sample, a high proportion of abnormal forms can impair the sperm's ability to penetrate an egg. Varicocele is one of the most common and treatable causes of male infertility. It's essentially a varicose vein in the scrotum that raises the temperature around the testes. Because sperm production is highly temperature sensitive, this heat can damage sperm quantity and quality. Varicoceles are found in about 15% of all men and up to 40% of infertile men. Hormonal imbalances in men can disrupt the signals between the brain, pituitary gland, and testes that regulate sperm production. Low testosterone, elevated estrogen, or problems with FSH and LH can all impair fertility. Blockages in the reproductive tract, whether from prior infections, injuries, vasectomy, or congenital abnormalities, can prevent sperm from being ejaculated even when production is normal. Absent vas deferens, the tube that carries sperm, is seen in men with cystic fibrosis gene mutations. Infections such as sexually transmitted infections, mumps orchidis when mumps affects the testes, or prostatitis can damage sperm production or cause scarring that blocks sperm flow. Lifestyle and environmental factors play a significant role. Heavy alcohol use, smoking, anabolic steroid use, recreational drugs, obesity, exposure to heat, hot tubs, saunas, tight underwear, and prolonged exposure to environmental toxins like pesticides or heavy metals can all negatively affect sperm. Genetic causes, including Klinefelter syndrome, XXY chromosomes, or Y chromosome microdeletions, can affect testicular development and sperm production at a fundamental level.